there, today we'll be discussing the paralleling technique. The paralleling technique is used when exposing periapicals. So we have a Dexter demo here. We'll be using the method of the direct digital. This knowledge can be transferred through all the methods, being the traditional, the PSP, or the sensors. So first of all, before we do anything, we want to make sure our patient is positioned properly. So with that being said, we want our occlusal plane to be parallel or flat to the floor. So when the patient is closed, we don't want their chin to be elevated or down too far to the chest. That'll make it a little bit difficult and alter our positioning. So as close as you can, you want the occlusal plane parallel to the floor. Okay, so now that that's done, we're going to demonstrate taking a periapical of the patient's 3/6. So first of all, we want to make sure or identify the long axis of this tooth. So we want to see the occlusal plane or the occlusal surface of the tooth and identify where you think that root or the apices and the root tip lines is. So you have to visualize that. You want your receptor to be parallel to your long axis. So if your tooth is in this position, you want your receptor to be parallel to it. So another example of that, or where you would alter that, is in the front. If you were taking a periapical of the anterior area, we typically the positioning or the long axis of our teeth will be more labial. So they won't be straight up and down, and they can be more lingual, but typical there's a little bit of an angle outward. So we want to actually, if lining up an anterior receptor, you would you position them parallel together. If not, you will have your receptor flat and your teeth would be positioned in this way, and that would create an elongation or an alteration. Okay, so we have our 3/6 here. We see that the long axis is quite perpendicular to the floor, and that's how we're going to aim for our placement of our receptor. So we're going to position the receptor lingual of the tooth, and we want to position it parallel. So in a mandibular PA, posterior PA, we will be positioning our receptor quite snug against the lingual surface. But for an example, or for instance, if we're taking a PA of the max, it's suggested that we go more midline. So in the case here, instead of being right snug, close, bumped up against the lingual surface of the max, if we were taking one of the 2/6, we would be more midline, position it more midline. Okay, so all periapicals will be positioned more midline except for your mand posteriors. Okay, so I'm just going to readjust my XCP kit. And we're going to continue in positioning. Alright, so we're going to bring our receptor in, and we're going to line it up. We want it centered. So if the dentist or the requisition is for a 3/6, we're going to center our 3/6 on our receptor. And we're going to make sure that it's parallel to the long axis of the tooth and centered there. So before I actually, have the patient close, I want to make a two-point contact, or what we call seat the receptor. So this is the bite block. We want this bite block to be touching the tooth. So I'm going to slowly and gently push it down, and that'll guarantee that we're going to get all the way down so we can get the apex and the apex of the teeth. Okay, so now that it's closed down, we're going to support it and seat it. We'll have the patient slowly close down, and then we'll line up our XCP kit as close to the cheek as possible, and then we'll line up our PID. we want our PID to be the window, we call the face of the window here, to be parallel to this black ring when using an XCP kit. Okay, it doesn't have to be touching it. It could be further away, but as long as it's parallel. This is a guide for you. Okay, so now that I've lined up the PID parallel to the window, and we've positioned this receptor parallel to the tooth, that's the paralleling technique. We have a receptor is parallel to the tooth long axis, which is parallel to the ring here, and our PID. And this will shoot our central ray right through the teeth. Again, because we've centered the tooth, we won't miss any of the anatomy. Okay, so one thing I want to mention too, PAs in general can be a little bit uncomfortable. So we have a rule called the TPR, and that helps with the success of your exposure and the comfort for the patient. So T stands for tilt. Not sure if you noticed, but when I was entering in with the sensor, the receptor, any type of receptor, you want to angle it in. You don't want to kind of jam it in, and you don't want to have your patient, they don't have to open as wide as possible. And some patients cannot open that wide, so you have to angle it in, and then you'll position it. So that's the P. The position is P. The position's for P. So again, we're going to center it on the receptor. We're going to seat it, our two-point contact. We're going to make sure our sensor is parallel to the long axis of the tooth. And then the R stands for relax. So the patient is you're going to have the patient relax and slowly close down. Relaxing allows for a lot of space within the cheek and of the floor of the mouth, which would be more comfortable. If they're tense and tight, it may be uncomfortable. So if they're relaxing as they're closing, it'll become more comfortable for the patient. And just like that. So that's the that's the TPR. And that is our paralleling technique.